Assalamu alaikum. Today I'll be presenting on a very essential clinical skill, that is how to take a pediatric history. This skill is slightly different from adult history taking. A good pediatric history is the cornerstone of diagnosis in children. Unlike adults, children may not be able to express themselves, so we rely heavily on the parents or caregivers as well as our own observations. And our approach must be thorough, gentle, and family centered. So first of all, let's see that how it is different from adult history. So pediatric history is often taken from parents or guardians. Communication depends on child's age. Our main emphasis is on birth, growth, and development. Immunizations and perinatal history are crucial. Now let's move towards the structure of it. But before taking history, we begin by introducing ourselves to the caregiver and the child. Always ask for consent, especially if you are a student, and as a doctor too. Clarify your role and make sure they are comfortable proceeding with. So these are the main points of this history: identifying data, presenting complaints, history of presenting illness, past medical history, birth and neonatal history, developmental history, immunization history, dietary history, family history, social and environmental history. Start with basic demographics like name and age of child, gender, parent or guardian's name, mode of admission like the child was brought in via emergency or OPD, and date of admission, address and contact. Now moving towards presenting complaint. Use the parent's exact words. Include duration. For example, if the mother tells you that my child had been suffering from fever for 3 days, then write it as fever for 3 days, or like for the feeding history, you can write it as not feeding well. And another example, instead of writing diarrhea, record it as mother says child has had 5 loose stools per day for 2 days. Now for the HOPI, history of presenting illness, we'll just look at a mnemonic. That is SOCRATES. S site, O onset, C character, R radiation, A associated symptoms, E exacerbating or relieving factors, S severity. S for site, so where exactly is the problem? For infants, you can ask the parent if the child points or touches a body part when crying. And for older children, you can just ask them to show where it hurts. O for onset. So you can ask when did it start? Was it sudden or gradual? You can ask, did it happen all of a sudden or slowly over time? For example, the pain started suddenly 2 hours ago while playing. Next, ask about the character of the symptom. What does the pain or symptom feel like? And for children, you can use child-friendly terms like, is it sharp like a needle or dull like a tummy ache? For pain, is it sharp, dull, burning, or cramping? For cough, is it dry or productive cough? With kids, use simple words or offer options when necessary. Next is radiation. Like, does the pain move anywhere else? And does it stay in one place or move somewhere else? For infants, their parents may guide you, and for older children, they can tell you on their own. Next is A for associated symptoms, like any other problems noticed. For example, vomiting, fever, crying, rash, sleep changes, poor feeding. Now, this is a key here. We ask what other symptoms are present. For example, if there is vomiting with fever and lethargy, it could indicate systemic infection or meningitis, and asking this helps guide the differential diagnosis. Now, next is timing. Is it continuous or does it come and go? When does it usually happen? At night, after eating, or during activity? Timing basically refers to the duration and pattern. Is it constant or does it come and go? Is it worse at a certain time, like night or after meals? And this can point to specific diagnosis. And one example you can note here is like asthma symptoms worsening at night is a classic timing clue. Now, next is exacerbating or relieving factors. What makes it better or worse? Does eating, moving, or resting change anything? And in infants, does carrying or rocking soothe the baby? Ask what makes it worse or better. Does activity, food, or position change the symptom? And this helps assess functional impact. Next is severity. Lastly, we assess how severe the symptom is. In children, we may need to ask parents how the child's behavior has changed. Are they eating, playing, or sleeping normally? And using the Socrates approach ensures that we don't miss any critical details, especially when symptoms are vague or hard to express, which is often the case in pediatric patients. Now, for past medical history, ask about previous illnesses, hospitalizations, surgeries, or any known chronic conditions, allergies, medications, blood transfusions, etc. Now, for birth and neonatal history, ask about antenatal events, maternal health, scans, infections. For delivery, you can ask about term or preterm, mode of delivery, complications, birth weight, whether the child cried immediately after birth, postnatal NICU admission, birth weight, jaundice. Now for the developmental history, you can ask about the milestone achievement in gross motor, fine motor, language, social. Were there any delays or regressions? Did the child sit, crawl, walk, and talk at appropriate ages? Moving towards immunization history, it's crucial to ask about vaccinations, whether the child is up to date and if they have received all routine immunizations according to the local schedule. Ask to see the immunization card if available. Now moving towards nutritional or dietary or you can say feeding history. Like you have to ask about breastfeeding or formula milk. If it is formula milk, then ask about dilution. If it's weaning, then when and how. You can also ask about current diet, frequency and quantity, appetite and feeding difficulties. So in general, you have to ask about feeding habits from birth till present, whether the child was breastfed or formula fed, when weaning began, and current diet patterns. This helps assess nutritional status and feeding difficulties. Now moving towards family history. So you can ask about hereditary diseases running in the family, their family structure, siblings' health, any consanguinity, and you can also draw a family tree as well for further diagnosis. And for drawing a family tree, I have just posted a picture for you guys for the help. You can take help from it while drawing. Now, social and environmental history. Understand the child's home environment, who they live with, exposure to smoking, hygiene, access to clean water, and school performance. These factors impact a child's health significantly. And at the end, summarize the key points from the history in your own words. Always thank the caregiver or guardian of the child or the child at the end and explain what the next steps will be. Be patient, use open-ended questions, observe child's behavior, respect the caregiver's concerns, and cross-check with vaccination and growth efforts. You can ask about other areas to cover in a systems review, and that include the following things. You can pause my video to note down these for history taking. I thank you all. Share my video with your friends and subscribe my channel.